Hey Stubby Nails Club, today we'll be talking about perineal scar rehabilitation. So when a client comes back to see you in a perfect world 8 weeks after they've just vaginally delivered their baby, we'll take a look at their perineum and you may notice there's some pinching or pulling towards one side. The other thing to keep in mind is that's in a perfect world that they come see you 8 weeks later. What if someone has a perineal tear from 10 years ago, 40 years ago, 60 years ago? The answer is, well, it's never too late to treat a perineal scar. I have treated scars that are 50 to 60 years old. They can still feel very bunched and tethered if they haven't been told to address their scar tissue. And are they still going to see the benefits of performing that scar tissue release? Absolutely. That can be game changing for so many different pelvic floor related functions. So with that said, let's go back to the scenario of the perfect world. Someone's just delivered baby, has a perineal scar at the posterior fourchette, for example, and you realize that it's pinching, plucking, and sort of pulling in towards itself. How would you address this 8 weeks postpartum? So the number one thing that we begin with is something called desensitization. What can happen at the scar tissue is that they can perceive a light touch sensation from their clothing, the spandex, the denim, or the cotton undies as a very pronounced pain signal or sensitivity at the perineum. So we want to break that down and ensure that our clients are comfortable wearing their favorite garments and not having an oversensitized response to that. So what you want to educate your clients on is start with desensitizing the scar after you've gone through the tissue healing phases 8 weeks later, or maybe it's 3 months later because your client isn't mentally ready to start this treatment, or they had an infection midway through, the open wound reopened, and they're like, you know what, let's just wait another couple weeks or a month. That's totally fine. As we said, doesn't matter. You can work on this scar tissue 10 years later if you wanted to. So still beneficial to work on. So starting out with something super, super soft. It could be a cotton ball, a Kleenex. What else could it be? Maybe silk, like something super gentle and smooth. What you want to do is at the area where the scar is located, and let's just assume for the purposes of this demo, it's right at 6 o'clock. What you want to do is you want to bombard sensation to this area. And so I'll ask my clients to do this for 2 minutes and then do this every other day, for example. Once they get comfortable with this feeling, they're going to move on to the next most uncomfortable or less smooth surface. So for example, it could be soft terry cloth for the next iteration. It could be cotton for the next iteration. So you kind of have to decide on a ladder of more and more progressively firm and coarse materials. Could be, this might be one of the last things. Denim, jeans, very thick denim could be one of the very last things to challenge that scar tissue with. And so it's really important to not miss out on this desensitization aspect, because that can really set your clients up for success when it then comes to direct perineal massage or direct treatment of the scar tissue itself. So absolutely start with desensitization. As they're going through their incrementally coarser material, you also want to initially address the mobility of the fascia, of the pelvic floor, of that scar tissue with breath. So what I usually recommend is challenging the stretch of that scar tissue through different positions of the hip and the lower legs. That could be windshield wipers with deep intentional breathing of the piston towards the perineum. That could be a supine twist, right? 90 degrees at the hips, 90 degrees at the knees, Tee out the arms, look the other way, opposite to where the knees are pointed, and deep breathe. Again, the cue is really the same. The cue is make sure you're deep breathing towards your perineum. Maybe you could slowly progress to a deep squat, a balasana type of pose with a bit of splaying of those knees. And that could be a really, initially a very deep pull, but eventually at the end, they're not feeling that connection anymore with that scar tissue, and they're not feeling a pull or a tug. So oftentimes my clients might say, initially, when they did a deep squat during the functional assessment, the initial assessment, they're like, oh, I really feel my scar tissue, or dang, I really feel a pulling, if they're not aware that that's actually the scar tissue and the fascia and that sensory input of tugging within their perineal region. But once you address the scar through some breathing and some other techniques we're going to show you, they might feel that disconnect right away in that deep squat. The next time you test, it may even look a little bit easier to get into that deep squat, a little easier to recruit their core, their pelvic floor. So that would be number 2, is address mobility of the pelvic floor and the scar tissue through different positions and deep breathing exercises. Number 3 would be not touching the scar, but mobilizing the scar tissue. And I like to call this one the drawing sun rays on a grade 3 drawing of a sun. So what I mean by that is, if the scar tissue was the big yellow sun, what you want to do is take 1 or 2 fingers and press the tissue, press the skin, the adipose, and pull that skin and tissue all 360 directions, or all o'clocks away from the scar tissue. So that's your sun rays, right? And so I'm really exaggerating here, but maybe the tissue is so tethered in certain directions, they can actually only mobilize it a couple centimeters or a couple inches, right? So what you want to see there is which direction is it most inhibited, and maybe spending some more time. Again, tethering, pulling away from the scar, deep breathing towards that scar tissue, repeat, move on. All of the mobility might eventually look similar to each other once you're done this step, but be patient, because it may feel a little intimidating initially to be really pulling with force at the scar tissue. There really needs to be a lot of reassurance with your clients, because I think the number 1 thing someone with a perineal tear that's relatively fresh, as in 2 months ago fresh, the worry is, oh my goodness, if I pull the tissue this way and really pull away from it, isn't it going to re-tear? So there needs to be a lot of education and reinforcing confidence so that your clients are compliant with the treatment. And you can absolutely show them with a mirror as you're treating in session, like, hey, look, there's no bleeding, the tissue's quite stuck together. In fact, it's having the opposite effect. It's actually quite stuck. It's not reopening at all. It's actually immobile. So really reinforcing that confidence in your client is going to be so important. Number 4, what we then do is we get closer to the scar, and we might even do some compressive techniques. So you might want to get a little bit closer, and I can't show you here, but on my hand, I feel like I'm a makeup influencer now doing this. But you want to press and pinch towards that scar, hold, and deep breathe. And that's going to feel like a different sensation for the scar. As a next step, you can also begin to press the edges of the scar and start tugging perpendicular or alongside the scar. As in, again, if this was the scar, you can start pulling away at the edges. You can also pull very close by and pull away from the scar. You can also eventually pull along the scar, holding down one side of the scar and using the other hand to pull in the other direction. You can also hold down this part of the scar, pull the other way, and you can do that transversely or along horizontally, let's say. The next step is I'm actually going to skin roll on top of the scar. And so this one is one you may want to wait on until all the other steps have been very, very comfortable. What that will look like is exactly your skin rolling techniques, but now you're addressing, you're incorporating that with the scar tissue there. And what you might find is it's really tough to keep a continuous skin roll over top of that scar. That's okay. You can break it down into rolling towards it. And if you lose that hold, continue as you go along across the scar. So this would be a perpendicular demonstration, but don't be afraid to go up to down or down to up. Don't be afraid to go diagonally. Remember that, again, fascia is every which way. Scar tissue heals every which way. So you really want to challenge all the different directions, the directions of the asterisk. If you guys have taken any of the visceral fascial mobilization courses, you guys know that there's 2 additional treatment options for the perineum itself. Those would be the urogenital diaphragm or triangular ligament treatment of this section here, as well as the urogenital diaphragm and urethral mobilization technique. Now, these techniques we won't be explaining in this video, but we do strongly recommend that you invest your dollars into taking one of either Baral's courses or Ramona Horton's visceral mobilization course for the urinary system is where she teaches some of these techniques. One of them is internal, one of them is done external, but over top of the perineum. These 2 are techniques that you may want to sprinkle throughout the treatment of the scar because they're rather gentle compared to some of these cross-frictiony mobilization treatments or skin rolling treatments we had just mentioned. If you guys want to learn a little bit more about that, check out her course or take a look at the Patreon video where we describe in very little detail what that urogenital diaphragm treatment might look like. Okay. We hope you enjoyed this video. If you guys are interested in finding out our top 3 favorite treatments that are absolutely game-changing for perineal scars, check out our Patreon account, which is under the same name, the Stubby Nails Club, and we hope to see you there. Please leave a comment if you like this video, and we'll see you next month. Okay, bye.